Hi, I'm Dr. Craig Butler, your Northwest Ohio chiropractor, and this morning we have Virginia in the office, and she's one of my best patients. She's fun to adjust. But Virginia sews a lot, and when she sews too much or spends too much time sewing, her upper back gets really tight and it goes up into her neck. Is that what's going on today?
Yeah.
Yep. So
plus the lower back's been bothering me right in here.
Okay, gotcha. So we're gonna just give Virginia once over here, probably adjust the full spine, and we'll see how we're doing after that.
Now is this gonna pick up my
Yeah, it will. So don't make any crazy noises, right?
Yeah. Yeah, right there.
Yeah, the left side. Yeah. So left SI is a little restricted. The right's not too bad. And we come up, and she's just always really tight. She spends too much time at the sewing machine. Shh. You have one of those posture braces, don't you?
Yeah.
Do you use
but
that?
I got trouble with this one shoulder.
Yeah.
And when I put that in there, it just kills.
I'm going to show you a way to do that so it doesn't
kills the shoulder.
So that it doesn't hurt your shoulder.
Okay.
There's a different way you can do it. So have you sit back. Okay. Right there. Okay. All right, so we're going to start off at the very top today. We're going to adjust your occiput. Okay.
Okay.
Right. So that's the occiput is the base where the base of the skull meets the spine.
Oh.
Okay. So it's the very top. So let this come over and let your chin kind of out. There it goes. Good. And now on the other side, we're going to come down and C7 right here.
Right there.
Yeah.
There's a sore spot.
That's a sore spot. Let the chin down. There you go. And come back a little. Good. And a little bit of rotation.
Oh my goodness gracious.
That was a good one.
Yeah.
All right. Let's have you lay on your back on the table. Great. Have you scoot down about 6 inches. Perfect. Cross like that. She's really tight. The upper thoracic's like T3 right here. I want you to scoot down a little more. Good. Almost tighter than usual.
Yeah.
Alright, lay back. Look up. There it goes.
There it goes.
That moved great. We're going to get one more lower part of your rib cage. There that goes.
Oh yeah, all the way down.
I told you you're moving all over the place today.
Yeah.
Let's have you on your
At
side.
least it's easier,
Yeah.
don't you?
Yeah. Yeah, you're not making me work too hard.
That's good.
Yeah. Great. So, we're going to bring this knee up. Straighten out the bottom one. Okay, so this SI joint isn't real bad. We're gonna get a little motion there. One more. Let that move.
I go say I
Let's
didn't
go over to the other side.
feel anything moving there. This is the worst part of the whole thing.
Move it, I know. Everyone complains about the thing.
Ouch. Shoulder.
Shoulder still bugging you?
Oh yeah.
Okay. I'm gonna slide it down a little bit. That's good.
There. It's just when I put pressure against it.
Gotcha. Yeah, move that way. So, okay. Come on up.
Thank you.
Good. And let's bring it back in the chair. I want to check your shoulder out.
Okay.
Okay. So it's hurting like right in here.
Yeah, it's right.
So
right in
AC.
here, and then of course it'll hurt down
Shoots down a
into
little
here.
bit. Okay. Is
That
it
muscle, it feels like the muscle down in here.
Okay. Is this where it hurts?
Yeah.
Tell me, is this a little sore?
Yeah.
Okay. So she's having pain right over the AC joint, the acromioclavicular joint, and that's where the collarbone comes across and connects to the shoulder blade. And she's really So she's really restricted where the collarbone goes into the sternum. So if this can't rotate and pivot well, then we start seeing things get jammed up at the AC joint. So we're gonna work on seeing if we can loosen that up right there and see if that creates a little easier motion on the outside. So let me have you sit up. Okay, straighten a little bit. Great. So what I'm gonna do, I'm putting my right hand fingers on the sternum here, and we're gonna pull here, and we're just trying to get that SC joint, sternoclavicular joint, to open up. Let it relax. Okay. Now we're just gonna come back on both. And we didn't get a lot of release there.
No.
Yeah. Lay on your back.
Okay. I didn't realize that was so sore there.
Yeah. Is it real sore on the right too? Not so bad.
It's sore, but not as bad as right here.
Okay. Yeah, let that down. You can. And let that up.
Oh,
there we go. I know that one. That's not a fun adjustment.
No.
Give me a second. Okay. Come on up. And we'll bring you back to the chair.
Oops.
Alright. Not as bad?
Not as bad.
Okay. I want to see.
Sore, but
Yeah.
not as...
It's moving a little. You're still tentative. You don't want to move it.
Yeah, I mean, it's hurting. Not real bad, but it's an ache.
There we go. We're just going to work on it like this a little bit more. Good. Good. So, I'm assuming this is just part of your sewing habit. Because right, you're at the sewing machine like this.
Yeah.
So everything's just kind of scrunched down.
Yeah.
All the time. So we're just trying to do the opposite here today.
Yeah.
All right, let me have you like face down. So now what we're gonna do is we're gonna get your shoulder blade moving a little better. So when people start having shoulder pain, it's their body's natural reaction to try and stop moving the glenohumeral joint, or the actual shoulder joint. And what they'll start doing is a motion like this. So when they go to lift their shoulder, they'll go like that. And that's something that's called Gothic shoulder. And so the shoulder blade tends to go up. Good. So what I'm going to do here is I'm trying to just mobilize the shoulder blade down and back, and she can feel that. And it's gliding really well over the rib cage. Now this time what we're going to do is, all right, I want you to hold that there. Got it?
Yeah.
Okay. So what we're doing now is activating the lower trapezius. Push against me. Push. Come on, you got it. There you go. Don't lift your head. Just push your shoulder. There you go. And we're getting her to turn on that lower trapezius muscle so that we can inhibit the upper trapezius muscle. So relax. Which the upper trapezius is what turns on when we're having shoulder joint pain and takes over for the rotator cuff. Okay, hold that. Push. Come on. There you go. Right there. Use this muscle. There you go. Good. Relax. Okay. Oh, yeah. You didn't know what you were in for today.
No.
Yeah, you should have talked about that shoulder. Huh?
Yeah. Well, when I went up on my elbow, it hurt so bad. It
yeah.
so bad.
Yeah.
You know, because it's pushing right here.
Right. Yeah. Let's bring you back in the chair.
Oh. Whew. Making me sweat.
You had to work a little on that one. Okay, I know we didn't check this before, but I just want to see. Can you touch this shoulder with this hand over your head? Like this?
Like this?
Yeah, but I want you to use the bad one.
Yeah, we'll see.
Oh, that's not bad.
Nope. And it's not killing me.
It doesn't hurt?
No,
Great.
it's sore, but
Can
it's
you touch?
not.
Can you touch down here? Can you go the other way? Yeah. Yeah.
This one.
Yeah, that's easy.
Oh, I finally can.
You couldn't do that before?
I couldn't do that
Okay.
because I tried to
I
scratch.
should have checked it before, but I didn't realize we were
Yeah.
working on your shoulder today.
Yeah, I could never get my arm back there to.
Yeah, that's
scratch.
perfect. That's perfect right now. That's
You know,
about,
I could this one.
I mean, they're equal right now.
The scratch was always
That's
just
great.
right over here.
So I want you to start wearing your brace more when you sew.
Okay.
And what you do, so if it's hurting in here,
Yeah.
all you do is you take the strap and you slide it down here.
Oh.
Okay?
Okay.
And it'll take the pressure off, and it's still gonna hold down. And you can do that on both sides if you need to.
Okay.
Okay.
Because
So
it
try
would
that
just get the.
Yeah, I know it gets really
so
sore.
bad.
It gets really
Yeah.
sore in there when you wear it too long.
Right.
But if you wear it down here, it won't get as sore. Okay.
Okay.
So just you put it on normal, and then take the straps and just slide it down.
Just slide it down.
And you'll feel it right away.
Okay.
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 So cool. So that was an interesting adjustment today. We worked on shoulder, and it seems like we made some improvement. She's still a little sore in there where we worked, but I think that'll get better. And well, thanks for watching. I'm Dr. Butler. You got anything to say?
No, he's just helping me a lot.
All right.
That's all I can say.
Cool. You guys have a good one.